Eric Hammer here, registered physiotherapist. Today I'd like to talk a little bit about hip arthritis. So essentially when I see a patient who presents with arthritis in the clinic, so typically in a lot of cases they will have gone to see a doctor perhaps and had some sort of investigation done, right? So they've had perhaps an x-ray of some type, and typically on the x-ray it'll show some sort of moderate to severe arthritis. In a lot of cases, individuals who just have some minor or really not a lot of arthritic changes in the hip, they won't actually present with any specific symptoms, right? So it's usually the more severe arthritis or hip arthritis that essentially are coming into the clinic. So in a lot of cases, these particular patients, they'll present with very specific restrictions in the hip, right? So in a lot of cases, internal and external rotation in the hip will be limited. They'll have some pain that goes down into perhaps the groin area. Typically there'll be pain with hip flexion beyond 90 degrees. There might be pain with any sort of compressive type of activity. So for example, prolonged walking, going up and down stairs, impact type activities will potentially be uncomfortable for them. The other thing I do find in a lot of cases is some of the muscles in the front of the hip, so the psoas, the quads, for example, will be really tight. And essentially what I notice is in a lot of cases, these particular muscles, they're basically guarding, right, against pain in the hip joint. And so from a physio standpoint, there's a couple of things we want to do. Number one, we want to see if we can increase mobility. Now in a lot of cases, what I'll recommend is some form of manual therapy of some type, so that might be some traction, some soft tissue work, also some non-weight bearing cardio, right? So going on a bike perhaps, getting in the pool. These type of activities, because you're offloading the joint, but also moving the joint in a non-weight bearing position, they can actually help to lubricate the hip and help in terms of relaxing some of these muscles that essentially are guarding. And then the other thing I'll typically work on is again, exercises to release and offload the front portion in the hip region and actually start to strengthen the glutes. So in a lot of cases, individuals, because of pain, will actually not be weight bearing as much on their affected side, and so they tend to lose strength in the glute muscles and in through the pelvic floor, and that tends to become a bit of a vicious cycle, right? As you reduce the weight bearing on that painful side, well, all of a sudden all those muscles on that side, they get weaker and weaker and weaker. And then, as I mentioned, from a functional perspective, we become more limited then on that side. Please make sure to check with a physiotherapist to make sure that this advice is appropriate for you. And also, I'd really appreciate it if you find these videos useful to subscribe below, and have a great day. Thanks again. Take care.